Hello, this is John O'Connor. I'm at the NIC show in Chicago. I'm here with Larry Lane from Genesis HealthCare. And Larry, we just finished a very informative session and talked about reimbursement and some other issues. One of the things that a lot of people are worrying about right now, or at least considering, is the difference between the House and the Senate versions of the healthcare bill. Could you talk briefly about what's at stake here for providers?
Oh, thank you, John. The challenge with the House bill, H.R. 3200, is over 1,000 pages long. Buried in that piece of legislation, though, are about $36 billion in reduced funding for skilled nursing facilities. The other part of that is on top of the $12 to $15 billion that have been taken out by the skilled nursing rules. The House measure has a number of complications for SNFs, of which the most is the resource issue. Over the summer, there has been a lot of grassroots activities coordinated through the national trade groups, but really getting the message back home that absent adequate resources, we can't expand staffing. Without expanded and improved staffing, we can't have quality. That message has resonated, and there has been behind-the-scenes negotiations with the Senate Finance Committee and with Senator Baucus. The Senate piece of legislation that was introduced by Senator Baucus last week, which at the moment is under discussion by the Senate Finance Committee, starts with a significant reduction in its impact on skilled nursing, approximately $14.6 billion over a 10-year period. That is still a challenge for us to confront.
Very, very good. Now, one of the things that's changed since I started covering the industry is there used to be a lot more of a kind of a silo mentality, if you will, between the different associations that were out there. And it seems like the organizations are working better these days. Is that your impression as well, Larry?
I'm excited with the fact that over the last 3-4 months, with the challenge of healthcare reform, there has been a need for us to present a unified image. And in fact, earlier this week, there was a joint letter to Senator Baucus and to the members of the Senate Finance Committee, signed by American Healthcare Association, the Alliance for Quality Nursing Home Care, and the American Healthcare Association, that laid out in a very clear fashion two high priorities. The priority that adequate funding must be made available, and that the cuts at $14.6 billion is still more than can be absorbed. The second is that the Medicaid responsibility must include Medicaid as part of the considerations in dealing with margins. That coming together and working united has had great impact on the legislatures because it reinforces that this affects the care to residents, not just impacting providers.
Very good. Well, thank you very much for your time, Larry. It's great seeing you again, and hope you enjoy the show.
Thank you, Jim.